Hello everybody, happy International Nurses Day. My name is Hayley Peters and I'm Chief Nurse here at Yeovil District Hospital and of course Somerset Foundation Trust. So this question, I became a nurse because, is a bit tricky for me because those that know me well know that when I grew up, this was nowhere in my sights. I think my parents firmly believed that I was going to be a teacher or a policewoman. And it wasn't until I turned 18 and for a whole variety of reasons, including some health issues and failing my A-levels, those careers were closed off to me. And it was happen chance that I became a nurse. It was happen chance that I sat in my college library and I happened to see an application for what was then it's not the NMC, it's something else that I forget. But I applied and I went home and I said to my dad, "Dad, I didn't get the grades I needed, but it's okay because I'm going to be a nurse." And he was absolutely delighted. So I guess I want to share with you why I stay in nursing. And there are three reasons. One is that the expertise and the knowledge that we bring as a profession changes the outcomes for patients and service users. Secondly, I stay because of the extraordinary teamwork that I'm privileged to be part of. And thirdly, and lastly, because of the compassion, kindness and dignity we offer people at their darkest hours and the difference we can make to people's lives. So not quite why I became a nurse, but perhaps why I stayed a nurse.
Hello, I'm Deborah Horta and I'm the senior sister for Skabo. And I became a nurse because I wanted to help people. I wanted to work in a hospital environment. And hey ho, a few years later, here I am.
My name is Basu. I'm working in a Kingston private wing Yeovil District Hospital as a staff nurse. I became a nurse because I am very passionate towards nursing so that I can make a difference in the people's life.
My name is Dawn Winkle. I'm the substance misuse specialist nurse at Yeovil Hospital. I became a nurse originally because it was something as a child that I always wanted to do, and my decision never wavered. I've spent many years in several different roles, but in 2003 I noticed that there was a large cohort of patients that I felt weren't getting the same standard of care as the other patients in the trust. And these were the substance misuse patients. At that time I was a pain specialist and I started the service deliberately to improve the standard of care that this group of patients had, because I believe that every patient deserves the same high standard of care. So the service now is very well established and covers well over 1,500 patients a year, covering the entire trust from paediatrics to A&E and over to maternity.
Hi, I'm Chelsea and I became a healthcare assistant because I like helping people and I want to encourage patients to live a healthy, independent life.
Hi, I'm Nigel. I'm a clinical research nurse. The reason I became a nurse is my dad died from aggressive prostate cancer and I wanted to give something back. I became a nurse as a mature student and I would wholly recommend it as a career. It's been a fantastic journey and there are lots of different things that you can experience.
My name is Riza. I'm one of the infection control nurses. Why I became a nurse? At first it was because of very selfish reasons, but through the years I realized that it's not really about me. It's also to be a blessing to others, and that's the very reason why I became a nurse. Thank you.
So I'm Sara. I'm the brain, sarcoma and head and neck nurse specialist at Yeovil. And I became a nurse because as a child I spent a bit of time in hospital and I was inspired by the nurses I saw there. and went on and did my Duke of Edinburgh, and I did all my experience there, my voluntary experience in hospital, and did work experience in hospital, and I've gone on to keep wanting to be a nurse until now, so that's a number of years later. Thank you.
Hello, my name's Glenn Salisbury. I'm Head of Safeguarding for Yeovil District Hospital. For as long as I can remember, I always wanted to be a nurse, and this may have been compounded by the fact that back in 1966, at the age of 8, I spent 8 weeks in Frenchay Hospital in Bristol, with my parents only being able to come and visit me at the weekends due to my father being a farmer and only having Sundays off, and my mother couldn't drive, and there was a very poor transport link between Somerset and the hospital at that time. I recall being cared for by wonderful nurses who embodied me for the real sense of compassionate care. I commenced my nurse training in 1975 here at Yeovil District Hospital when we had the Somerset School of Nursing in place. I've always wanted to care, and care means to me being compassionate, continuing my professional development and creating learning opportunities, being an advocate for others, actively seeking new opportunities and experiences within the nursing role, reflecting on how I continue to embrace the nurse role and recognising my responsibilities to be a good role model, and empathy and encouraging others. I've been in nursing now for 47 years, and I'm now in the autumn years of my career. Looking back, there have been many significant changes within the nursing role, but I would do it all again. Yes, without hesitation.
Hi, my name is Julie Somintak. I'm from Special Care Baby Unit. I'm a neonatal staff nurse. I became a baby nurse because the fulfillment that we get from taking care of the teeniest humans and their family is incomparable to anything.
Hello, my name is Sharon, Sister Field. I am the Clinical Frailty Lead for Yeovil District Hospital, also the Sister for the Frailty Assessment Unit. I became a nurse because I wanted to care.
Hello, my name's Ruth. I'm a nursery nurse in Special Care Baby Unit. During my training, I worked in a neonatal unit, and that's what decided my career path.
Hi, I'm Mandy, and I am currently an elective flow coordinator. And I became a nurse because I started here in Yeovil 29 years ago giving out teas on the elderly care ward, and I just wanted to do more, so I thought, why not bite the bullet? I done it.
My name's Alex, and I'm a children's community nurse based on level 10 in the paediatric department. I became a nurse because I wanted to work with children. I either wanted to become a nanny or become a nurse. I'm really glad I became a nurse though, because no 2 days are the same. I've done loads of things in my career and I really enjoy it. I love the diversity of the job, and I love meeting people and making a difference to people's lives.
Hi, I'm Mark Robinson, Deputy Chief Nurse. So the question is, I became a nurse because, well, that's a really good question, because I wasn't really sure what I wanted to do, but I knew I wanted to do something different. So when I was at school, went to a careers convention, and this was one of the options. So I took a look. I thought, yeah, I could do that. But you know what? It's been the best decision I've ever made. I can't say there's not been times I've not wanted to be doing it, but nearly every day I can think of something where I've been able to make a difference, whether that be for a patient, perhaps a colleague, or somebody that I'm supporting through a difficult time. And I want to be there for the rest of my career, supporting you to be able to deliver the best care that you can possibly deliver. Happy Nurses Day, have a great day, enjoy the time together, and celebrate everything that we've achieved.